Hello, my name is Harry Vandermeer, the Executive Director at the Office of Sustainability and Energy Management for Alberta Health Services. We are the sole healthcare provider in the province of Alberta.
Hi, I'm Michael Deane. I work for CLEAResult. I'm the Senior Program Manager over Strategic Energy Management in Canada. So just to give you a little bit of background in terms of energy management and strategic energy management in Canada, CLEAResult started working around 10 years ago in BC with BC energy managers giving kind of one-off coaching support. In the last 3.5 years, we have started doing SEM cohort work. So 3.5 years ago, we launched our first SEM cohort with BC Hydro, so we're very happy about that. Since then, we've seen an awful lot of growth within SEM in Canada. We're actually the largest growing region within CLEAResult, and we've now grown from BC to Alberta and into Ontario. So we're super happy about that, and we're hoping to continue to grow. So just looking here at this slide, it just kind of lays out a few of the numbers that we achieve annually to working with different clients and different agencies, utilities and participants. We're currently working with around 420 facilities all around those 3 provinces that I just mentioned. Our typical electricity savings that we see coming out of our programs are around 4.9%. On the natural gas side, it's around 6.7%. And it's worth mentioning that that is just from the implementation of low cost, no cost measures, which is really the focus of SEM. Any capital measures or capital implementation would be additional to that. So that's something worth mentioning. So that all equates then to around 105 million kilowatt hours that we're saving annually and 6.6 million gigajoules that we're saving annually. And for the American folks, that equates to around 62.6 million terms. So now I'm going to hand you over to Harry to talk through the Alberta Health Services numbers and what they achieved in their first year of their SEM cohort.
Hello, so with Alberta having one healthcare provider, we have about 400 sites throughout the province of Alberta. Of those sites, about 100 are acute sites, and the rest are either public health centers, emergency medical services, or other supporting buildings such as offices and warehouses. So we entered the program. We selected 6 sites to be a part of this program. 2 are in our what we call our South Zone, Medicine Hat and Lethbridge. We had a couple in Calgary, 1 just outside of Edmonton, and 1 in a more of a rural area called a place called Wetaskiwin. And so the baseline of all those 6 sites was almost just over 56 million kilowatts a year, and about just over 500,000 gigajoules, or 5 million therms a year. And the baseline of our emissions was just over 100,000 tons of greenhouse gases. Before this program began, none of our 6 sites had a formal or informal energy team. We are, as I mentioned, we're divided into 5 zones, and one of the zones did have a energy team that kind of got together, but they mostly focused on lighting retrofits, and we're not so focused on recommissioning. But existing staff didn't notice how savings could be found through either implementing no cost or low cost measures. So we find that a lot of our infrastructure was already in place as far as building management systems, but things were not finely tuned. And there's always an opportunity to be able to take an existing system, looking at the schedules, looking at the set points. What we find is our operators are very good about meeting the needs of our clients. As if they're too cold, they're too hot. When construction comes to the line, we need to turn things into a different situation. But often they forget to turn things back the way they should be, or to really optimize things. And our operators did not have a deep understanding of the buildings or the potential for energy savings. So through this program, what we did was just all the many questions that CLEAResult was able to ask about how the building was running, why it was running a certain way, why a set point was at a certain set point, why we were running a longer schedule for our equipment than maybe had to be on because our occupancy was either reduced or down to 0 at that point. It gave the opportunity for our operators just to enhance their equipment. So the things we did was adjusting set points and trying to meet our set points for the application we needed at that point in time. We looked a lot at changing our lighting. So we have other programs that are more capital in nature where we do LED upgrades. But we also have the opportunity with this program to look at some of our sites where we had scheduling programs that are simply not being optimized. Or perhaps the person that was trained on them had moved to a different site or left the organization, and the people they replaced them did not have any training on the new system. So the system was just kind of sitting there. Our building management system, that's where the real optimization took place. Looking at boilers and makeup air units, making sure things were operating correctly, and behavioral change that came into place with scheduling our equipment properly. We eliminated some computer screensavers when they did not have to be on, and also just trying to get people to be more aware of the impacts of their decisions on our utility bills. Seasonal changes. Often set points are set at a certain point, either the temperature or maybe the pressure on the air handling units for the peak conditions, but of course we're never at peak conditions, very rarely, either in heating season or cooling season. So we had a chance to train them to be able to adjust those set points to meet building requirements at that particular time. Engagement with some of our end users. Things like space heater policy and thermostat education program, making sure that our clients knew the impact of the decisions they made when they did things like turn on a thermostat or walk out of the building without thinking about turning things off. And so one of our operators, one of our champions, Charles, had mentioned the awareness attained through this program as being instrumental in its success. So, and this is not just for our operators, but also our, as I mentioned, our end users, our clients who often are kind of doing their clinical thing and don't often realize the impact the decisions they make have on emissions and on the cost to operate our buildings.
Great, thanks, Harry. So all those impacts and changes within AHS and working with Harry and his team result in a lot of great benefits. Before I jump into the obvious energy benefits, I kind of want to talk about some of the non-energy benefits that typical SEM participants see through the program. So some of the typical non-energy benefits that we see are reduced equipment change out because equipment is running more efficiently or less. That also has an impact on safety because less equipment and safety change outs are required. So we see some really good benefits there. And as Harry kind of alluded to, there's some great employee upskilling and increased engagement coming from the teams and from the wider organization as well. So that's some great benefits that we see outside of energy efficiency. So all the numbers here are coming from low cost, no cost. Again, capital would be additional to that, but what we see when an SEM program is running in parallel with a capital program, we typically see over 20% increase in capital project uptake. So we actually help drive traffic to those capital programs. And the reason for that is because we're identifying more measures for the different participants. We're training them up on how to sell measures and projects internally, and we see greater follow through with the participants going through capital intensive programs. So looking at the low cost, no cost measure impact here, we can see that in the first year alone, 90 energy conservation measures were implemented, resulting in a saving of 6.6% over gas and electricity. That equated to around 3.8 million kilowatt hours and 32,000 gigajoules or 310,000 terms. All of that because it is a GHG program related to 4,160 tons saved, and that then received a savings and milestone incentive from the client, who was Energy Efficiency Alberta, equating to around $132,000 for year one. And the savings for AHS didn't stop there. They saw some huge savings on their bills as well. Through the gas and electric savings, they saw roughly around $495,000 savings in their bills in the first year. And because these low cost, no cost measures typically have a measure life of 5 years, if they continue to sustain those savings, they will see around 2.5 million of savings coming from their bills in the next 5 years. And I just actually had a look at their year 2 savings, and they're actually outperforming their year 1. So we're really happy for them. They're successful and that they're being consistent and continuing to push the boat and chase more savings. So we're happy for them with that. And I guess on that, I'd like to thank AHS, especially for presenting with me today, but all of the participants that we've had in the past and currently, and a special thanks as well to the different utilities, agencies and clients that we've had both currently, in the past and in the future, because running the programs and running these SEM programs and allowing us to connect with your participants and customers is having a huge impact. And Harry and his team is just one example of that. So we're looking forward to growing SEM even more within Canada and the US in the coming years.